Benzene and Acute Myeloid Leukemia, AML. We want to tell you about Joe, a 60-year-old firefighter. He developed AML, which is a malignancy of bone marrow stem cells where the stem cells do not mature but proliferate and spread from the bone marrow to the blood. Stem cells arrest at the myeloblast stage in individuals with AML. Myeloblasts are the precursors for granulocytic white blood cells. In healthy bone marrow, myeloblasts constitute less than 2% of cells, but in AML the myeloblasts exceed 20%, leaving no room for mature granulocytes. As a result, the patient's immune system and coagulation system weakens, so patients become vulnerable to infection and inhibits their ability to stop bleeds. AML progresses quickly throughout the body and is fatal within weeks or months. Benzene is an organic carcinogen compound, which causes AML, is frequently used in personal care items as well as cigarettes, and in industrial emissions. Benzene is known to induce oxidative stress, which damages stem cells in critical regions, making them dysfunctional. This changes DNA, makes it unstable, and alters the gene expression which causes cancer. In AML, an important gene that is silenced is called human mutator L homolog 1. Oh, what a mouthful. Let's just call it HMLH1. When HMLH1 is silenced, it has a cascade effect on other gene silencing. One silenced gene is called DNA mismatch repair gene, and without this gene we can no longer prevent any further damage to our DNA. Joe was sick with fever, bone pain, easy bruising, pallor, shortness of breath, lethargy, fatigue, frequent infections, bleeding from the gums, and gingival enlargement. AML is usually seen in older individuals like Joe, but it is increased with exposure to benzene or other toxins, radiation exposure, smoking, and hereditary conditions. Joe's disease was diagnosed as AML by looking at a bone marrow aspirate. Microscopically, the undifferentiated malignant cells are bigger than normal white blood cells with big nuclei. In Joe's cells, there will be our rods that look like brown lines. These rods are crystallized enzymes called myeloperoxidase and are typical in Joe's type of AML. They cause oxidative damage to endothelial cells, and with his low platelet count puts Joe at risk for disseminated intravascular coagulation, an abnormal blood clotting condition. Fluorescent in situ hybridization identified chromosomal abnormalities within Joe's DNA. He was offered treatment options like CAR T therapy, radiation, stem cell transplant, and chemotherapy. Joe opted for CAR T-cell therapy, which put him in remission for AML. After treatment, Joe was followed up with PCR and imaging and is doing great.